When Jennifer and Brian Alger's son got hurt playing soccer, the Portland couple did what most parents would. They took him to the doctor.
And we went straight from the soccer field to urgent care.
The treatment? Pretty straightforward. The 13-year-old broke his foot and was given a walking boot. But then came the bill from a Eugene company called Synergy Medical Systems. It demanded a payment of $129 for that walking boot. At first, the Algers thought maybe this invoice was for insurance to pay, not them. So they asked for an itemized bill. It showed insurance had already agreed to pay $300, and their co-insurance, the amount insurance didn't cover, was $129, which meant that walking boot cost a total of $430.
This is a company that's taking advantage of families in their most vulnerable times.
Keep in mind, this is not a particularly complicated device. A quick search shows the exact same walking boot is available online for about $50. Amazon has it for $64.99.
My expectation is that I'm going to be charged a reasonable market rate. I don't expect I'm going to be taken advantage of when I go to the ER or urgent care because something has happened.
The Algers contacted Synergy and asked the company to withdraw the $129 bill. Not because they couldn't pay, but because they felt Synergy had already collected enough from insurance.
Is this the company that you're trying to be? Take advantage of people when they really don't have options or choices?
So far, Synergy isn't budging, claiming these parents signed a waiver at urgent care agreeing to pay whatever insurance didn't cover.
Whenever we go to get our care, we are forced to sign a blank check.
Cynthia Fisher, founder of the nonprofit PatientRightsAdvocate.org, says healthcare is one of the few industries that tells you what things cost after the fact.
As long as hospitals and insurance companies hide their prices, they can charge whatever they want.
When asked to explain, Synergy referred us to its partner company, AMC Billing Services, which wrote in an email, "We built the Medicare standard rate. Then, from there, patient's insurance is the final say on cost of an item. Example, if a patient's insurance says an item is only worth $20, then that is all. That is all that can be collected." In plainer terms, insurers often contract with certain medical supply companies to provide equipment, just as they negotiate rates for other services. The Algers insurance company, Pacific Source, declined to comment. And the urgent care said, for those with health insurance seeking non-emergency care, patient responsibility or out-of-pocket cost is based on your specific insurance coverage and plan. Which brings us back to this walking boot, which cost 700% more than the online price.
If I were to do it again, I would have declined taking it and just ordered it and had it the next day.
Patient advocates say, when possible, ask about pricing. Find out who's supplying the equipment, if they're in your insurance network, and how much you'll owe out of pocket. If you can wait, pull out your phone and compare prices.
And you can say, I refuse to get it. I'll have it delivered to my door in a couple of hours. I mean, we are empowered to do that, and we can do that.
The Algers feel this $430 walking boot helps illustrate a broken healthcare system where profits come before patients. A couple other tips to keep in mind if you find yourself in a similar situation. Get an itemized bill so you can see what you and your insurance company are really being charged. And if you want to avoid buying, say, new crutches, ask friends or family if they have crutches at home you can borrow. Check with thrift stores, or there are nonprofits that provide used durable medical equipment for free to those in need. Kyle Aboshi, KGW News.